I just want to make a video here, give everyone an update on my surgery. I did have my surgery, and I'm going to show my incisions. So there will be some graphic areas, and I will put advance notice in the video where that is in case if you have a weak stomach. My brother doesn't like to look at stuff like that, and I understand it. Some of you don't like to look at it, but it's just part of life, and so I'm going to show it. But I did have my surgery on the 14th. Today is the 19th, and I'm going to talk a little bit about in this video what led up to it, the surgery, and right up to now. And another thing too is I want to thank everyone for their prayers. They mean a lot, so thank you everyone that's said prayers for me. It got me through the surgery, and now I'm on a 6-week recovery. But I want to go on in this video and talk about what led up to my issues and whatnot. So let me get to it here. So originally I had my last physical. I get a physical every year because I get a discount on my health insurance if I get one. And the last time I had one was back in, I think, January. It was before COVID. Maybe January 19 or 8, whenever, I think COVID has been 2 years this past week, or 2 weeks ago. But anyway, beyond that, I had my physical before that, a couple months before that, and pretty much all everything was good. My PSA, my blood sugar, cholesterol, everything came back pretty darn good. Then COVID hit. And so in 20, I didn't get a physical because the last place I wanted to go during the peak of COVID was to a doctor's office. And then, and another thing I want to state too is if you're male, it has any changes in the way you pee from the way you normally go see your doctor right away. Don't put it off a week or a month. Go immediately. My problem was I started peeing more frequently. I would get up in the morning and pee probably, 5 or 6 times instead of 2 or 3 times. And then throughout the day, I would go more and more often. And as time went on, I was going more and more often. And then, 20 went through and I didn't have my physical. In 21, I started getting these like welts on the back of my legs that really hurt. And I had that sciatic nerve. If you remember in some of my past videos, it was hard to walk. My leg would just give out. And I thought it was a sciatic nerve, and I went back to the doctor. And this was already after I was diagnosed with the 71 PSA, but before I'd seen the urologist. I'd just had my physical, and about 2 weeks after I had my physical was when I started feeling that pain in my side to where my leg would give out. And in one of my videos, I think I'd taken the Galaxy up to Stony Creek Metro Park, and I was actually doing something my dad wanted me to do. He wanted me to spread some of his ashes here and there. He has a list of everywhere he wants his ashes spread, and that's what I was doing that day. And that was the first time I was really able to walk in a long time, I guess because I was able to pee out pretty good before I left. But I was still having my leg give out, and then I went to the urologist, and he'd put the catheter in, and I felt that pain going away as my bladder was draining. I had 1,700 milliliters of urine in my bladder, and your bladder should hold no more than 550 milliliters, I believe he stated. And, you can Google all this stuff too. But anyway, that alleviated all those welts on the back of my legs. They all went away. They all completely healed up within a couple weeks of having my bladder drained. That sciatic pain nerve went away. But it causes the muscle tissue on your bladder to get stronger because it's, having to hold that stuff. So that's not good either. The urologist explained that's not a good thing. But I did go in and had other tests. I had bone marrow tests, make sure the cancer from my prostate. I had a biopsy after I went and had the catheter put in. They drained my bladder. Then I was set up an appointment for a biopsy. I went back in and had the biopsy. Then it was about a few weeks later, I got the results of the biopsy, and they came back. They took 12 samples. 11 of them came back positive with cancer, and it was significant. And it was significant enough to where they sent me to the hospital to have bone scans to see if it gone into my bones, to have other scans done with contrast and stuff to see if it had spread to other organs and whatnot. And it hadn't, thankfully. And so then there was really no treating it with radiation or anything. The cancer was that bad. And so they told me I would have to have a prostatectomy and, have my prostate removed, basically. And they did it robotically. I had my surgery on Monday, the 14th, at the hospital at 12 in Hoover. It's, I forget the name of it now. Ascension, Oakland, Macomb. It might have been St. John's. My dad had his back surgery there too. But anyway, so I went in. I had gone the week before for prep for the surgery, to where they told me what I have to do. I had to wash with special soaps, to antibiotic soaps, or not antibiotic, antibacterial soaps, and use clean towels every time I dry. They never wanted me to use a towel twice, and put clean clothes on every day, morning and evening, wash the bedding every day or two. And which I can't do right now, as I can't lift over 10 pounds, but it's getting done. And, but yeah, I wear, my t-shirt and sweats and stuff in bed, so the sheets aren't really getting dirty, but I change my clothes twice a day. And, so anyway, a little bit back to, I got prepped. I had to drink this special stuff to clear out my bowels, and that was no fun. It wasn't as bad as doing it for a colonoscopy, though. That was nothing. Colonoscopy is the worst. That stuff you drink for that is just nasty. The stuff that they had me drink it was only a little bottle, and it was grape flavored, and it wasn't bad, but it cleaned my system out, and then I had to do a fleet enema before I went to bed. So yeah, I could have had a colonoscopy with that. I don't know why they make you drink all that nastiness. But anyway, I'm going to show you my incisions in this video, like I stated in the beginning. And I will put a notice before that happens, and it's about 15 seconds of video. So if you have that weak stomach and you don't want to watch that, you can skip through it. Sorry, the furnace is coming on, and it's right above me there. I turned the heat up in the garage. It's been nice out. We had a couple 70-degree days here. I could have taken the convertible out with the top down, but I can't drive. I'm not to drive for at least 2 weeks. And it's not comfortable to ride in a car, and that's another thing too. They getting back to the hospital. I'm jumping all over, sorry, but getting back to the hospital. So I had to be there at 5 a.m. I got registered. They took me in very short order and started prepping me. They shaved I call my belly my taters. This is the fattest I've been in my whole life since I've had this catheter, because it's just so uncomfortable to walk. And so I haven't been exercising, and I've really cut back on what I've been eating, because this belly does not feel good with incisions. And when you look at the video too, you're going to see a lot of major bruising. That bruising doesn't hurt. It's just from internal bleeding from the surgery. But the belly button incision is about the only thing that hurts now, and I can get up and down fine. I'm most comfortable standing or walking. Getting out of bed is the hardest. The first 4 or 5 days, was difficult because I had to lay on my back in my bed because it hurt too much to lay on my sides. But getting back to the day I went into the hospital, so they shaved my taters and got it all iodined up, and got me rolling. Got 2 IVs because I had the surgery robotically, so I had an IV in each hand in case the machine rips out an IV. They explained all this to me. The anesthesiologist and the surgeon both explained all this to me. And so they rolled me down the hall into the operating room, and I'd never seen real life inside an operating room in my life. My mom's had many surgeries. My dad had many. My dad was sent home in '81 with open incisions that I used to have to help him clean because my brother and mom couldn't handle it. They had to be cleaned and redressed 3 times a day with hydrogen peroxide and water. I used to use this thing right here to mix the hydrogen peroxide and water in to clean my dad's incisions that were open. You could see his innards. And yeah, he was born with Hirschsprung's disease and was the first ever to survive it. You can Google it. It's basically where you're born without nerves and parts of your intestines, so you can't pass your stool through. But anyway, he was the first ever, he made a medical history, first ever to survive that surgery when he was 14 years old. And he also had a bout with it in '81, and that's when I basically just stayed home, quit working and stayed home and just looked after him for almost a year. He was off of work on sick leave for almost a year. And but yeah, they left the incisions open so it could drain, so he wouldn't get infections, because it was bowel surgery. He had a colostomy for about 8 or 9 months. Then he went in and they reconnected everything, and then that time they stitched him up. But when the first surgery, they left him open, and I would help clean his incisions. But anyway, getting back to it, this was the first time I've seen the inside of an operating room. And they rolled me over to the operating table, and I'm looking around in there, and the 5 or 6 people were in there, and they rolled me up to the operating table and lowered the handle on the bed that I was in to move me to the operating table, and it was lights out at that point. The next thing I remember was waking up in recovery about 3 in the afternoon. It was a 5-hour surgery, and it took a couple hours of in recovery before I started coming to, and everything was kind of a fog the rest of that day. I don't remember much. And then the next morning I felt really good. I got up and walked around the whole ward of the hospital, and doctor came and saw me, and he's like, "We're sending you home." And I was ready to go, because those hospital beds by no means are comfortable. My back was killing me from laying on that hospital bed. That's why I got up and walked around. It was like relief. And so anyway, I got home, and then they gave me pain pills and 2 stool softeners. And now I see why they give you stool softeners, because when you push to push stuff out, it hurts after you've had surgery. So they're a blessing. The pain pills, I still got some left. I saved them for in the evening, so at night when I go to bed, I wouldn't feel the pain. And I haven't taken any today, and there's still 3 or 4 left. I don't know, there was maybe, said I could take up to 4 a day, and I don't think I ever took more than 2 a day. And that was only the first couple days, and then it was 1 at night before I went to bed. And maybe tonight, we'll see, maybe I'll just take regular Tylenol tonight. But I feel really good today. Today is the 19th, so it's the 5th day from my surgery. And so yeah, I do feel good. And I think I'm going to show you the video here so you can see my incisions and whatnot, and then we will continue on with this video. So if you're really queasy and don't want to see that kind of stuff, you want to click off here. It's like I say, about 15 seconds. I'll put something on the screen to show when it pops up. So if you want to watch the whole video except for that, you can. And I'll put in that part how long because when I go to edit, that's when I'll know how long that bit will be. But I'm going to show it now, so here you go. Well, I hope nobody passed out, and those bruises that you see don't really hurt. The incisions are not stitched or stapled, they're taped or glued, so to speak, so it's like a white substance that pulls off as it's, you know, giving out. So you might see that in some of the incisions as the adhesive that keeps them closed. And next week, like I say, go in and get the catheter removed, and hopefully everything will be good uphill from there, you know. And thank you again for all your prayers, and thank you for your continued prayers. And I'm just working on getting better so I can get to playing with my Galaxy and finishing that Rio engine. Oh, and I don't know if I showed you or not. I can get up pretty good, and I can walk around. Like I said, it doesn't hurt to walk. I did find an original spark plug, Champion J11. And I also was doing some research. What else can you do when you're, you know, after surgery? This plug, the oil fill plug, is supposed to be red. So I'm going to pop that out, give it a quick bead blast, and that will become red. And but anyway, that's really not important right now. It's just I got to get better. So I got to walk around and move. It feels good to walk around and move. And like I say, getting out of bed is the most difficult part. But just wanted to really stress, if you feel any change in the way you urinate when you get up in the years, go see your doctor, have your PSA checked, get a physical every year. I regret passing on my physical now in 2020, but you know, it's the past. There's nothing I can do about it other than move forward. But don't put anything off if you have any irregularities in the way you go. I can't stress that enough. My uncle I'm half Australian. My uncle in Australia had radiation. He ended up with prostate cancer a while back here, 4 or 5 years ago, and he's been doing fine. And another thing too is the bleeding. My incision by my belly button there, that's where the prostate came out. And it may freak some of you out, but yes, I did ask the doctor, the surgeon. He asked me if there was anything he could do. Excuse me. And I said, yeah, I would like to see photos of my prostate. I want to see what it looks like. And so he did. He took photos and he showed them to me while I was in recovery and explained everything to me. And it was pretty interesting. I don't know. I just kind of, after my dad with his surgeries and helping him clean his incisions and stuff, it's just, my dad was always curious with that kind of stuff, and I guess I just take after him with that kind of stuff. I was just wanted to see what it looked like, and he explained where the sacs were to make your semen flow, and, you know, the body fluids to make that come out and everything, and showed me where, you know, everything about it. You know, so it was kind of interesting. And it was, you know, it was large. It was larger than what it should have been. It was, I guess they're supposed to be, you know, maybe around a walnut size or something. And it was probably a little smaller than, I don't know, it was maybe 3 or 4 inches around. And it was the color of a liver. And anyway, that's just kind of a little bit about my surgery. So I'm on the uphill, I'm on the mend. The video, if you did watch the video of my where I had my surgery, my big fat taters, I'm not used to being this fat again. It's just, I gotta get back to exercising once I get rid of this catheter. And I've really cut back on my intake to try and get some of this fat off. And I'm not drinking like Coke or pop or any sugary stuff. And I just need to get back in shape. It's just, I think that like after I eat and it pushes out my belly a little bit, it hurts more after I eat than before I eat. So yeah, I need to get rid of my taters. So that's going to be worked on this summer, hopefully, and get back to a reasonable size and whatnot. But anyway, I just kind of wanted to yap a little bit here and kind of give everyone the heads up of what's going on. And again, I want to thank everybody for their prayers. Thank you very, very much for everything everybody said for me in prayers and whatnot. So thank you for watching my video. I just wanted to give everyone an update on what was going on. And I will maybe do another update in a week or two after the catheter's out and I'm moving along okay then also. So again, thank you for watching my video.